Hi, YouTube. Welcome back. Today, I wanted to just talk a little bit about some of the symptoms that are associated with prolactinemia or hypoprolactinemia. Um, if you've already been diagnosed, your doctor has probably already talked to you about some of these things, or you've experienced them already, and that's why you went to the doctor to get something checked out. But I wanted to share them just so you have an idea of the common symptoms. Um, because before I got diagnosed, it took, I would say, almost a year. Well, no, not almost a year, a couple of months. I went to the doctor at least 3 times, and they drew blood, they did exams, didn't find anything, and it wasn't until that third time that a different nurse, really looked. She tested for some other things in my blood and saw that my prolactin levels were higher than normal, especially considering the fact that I wasn't pregnant or I didn't just have a baby. So just some things that you can look for if you think this might be you, or if you haven't sought treatment yet. These are some symptoms and other things that are associated with this condition that you may or may not want to talk to your doctor about. So most of these symptoms are going to be for women. There are a couple that are the same across the board for men, and I'll mention that as well. So for women, the biggest thing is going to be irregular menstrual cycles. If you are normally like clockwork, you can put it on your calendar, you pretty much know when it's going to happen, and then all of a sudden things just start getting irregular and you're not pregnant, that could be a possibility. If you already have irregular periods, then that may be something a little bit more difficult for you to determine. Another big thing is if you have any kind of like milky discharge from your breasts for women, that if you're not pregnant and you haven't just had a baby, then that is not normal. That is something that you want to talk to your doctor about. Something else will be an increase in acne or excessive facial hair. That is very common. Facial or body hair. If you're starting to notice more hairs around your chin or anything like that, that's something that you want to mention to your doctor as well. Something else is low bone density, which puts you at a higher risk for osteoporosis. And that's for men and women because of the increase of this hormone decreases estrogen and some other hormones that affect your bone density. So if you are going to your doctor for regular checkups and they happen to want to put you on some vitamins or something like that, maybe vitamin D, that's normal. So you want to monitor that with vitamins and probably also with your diet as well. Other things are a reduction of other hormones, which I found really interesting, which I want to spend more time on later, so I'll come back to that. Other thing are headaches. If you normally don't have headaches and you have a lot of these other symptoms plus headaches, that's something to be concerned about because of where the pituitary gland sits. If the tumor is large enough, it can affect your vision, and that's part of the reason why you get the headaches. I never really got headaches. I felt this pressure in my head when I would stand up or sit up or something like that. And I know sometimes you do get that if you stand up too fast, but I never had anything like that until this tumor started to grow. And then for me, I didn't have headaches, but I did have fainting spells, which my doctor said was most likely the cause of that. Because other than that, I've always been really healthy. Um, so headaches or visual disturbances, if the tumor is significantly large, it can press on the optic nerves. So if you're having any kind of blurry vision or vision loss along with some of these other symptoms, that could be an indicator. And if it's not this, it's just something that you want to talk to your doctor about because that's not normal. Um, and then the biggest one, not the biggest one, but one of the biggest ones is infertility. If you are a woman and you're not having regular menstrual cycles, or they've stopped altogether with some of these other symptoms, then you are not able to get pregnant or at this time until you seek treatment. With treatment, however, there is a possibility of still having children. So I don't want anybody to be nervous about that. That was one of the things that I was really concerned and upset about when I was diagnosed, because I do want children in the future. But as a symptom, infertility is definitely one of the ones on this list. Some other, the big thing that I really wanted to talk about was the reduction of other hormones as a result of the prolactinemia. If the tumor is large enough, sometimes it presses on um, it presses on the pituitary gland, which can affect the other hormones that are being released from that gland. And so, what I found that was very interesting is that um, it can reduce estrogen and testosterone. Obviously, men have more testosterone than we do, but women have certain levels of testosterone too. There aren't really as many effects as I've been reading so far, but again, I am not a doctor. I am not anything along those lines. I've just done some research on my own. Um, but the reduction in estrogen, I think, is very important because that plays into the low bone density and risk of osteoporosis. And some other symptoms of low estrogen are, that it can affect your sleep, it can affect your mood and your memory, and studies have shown that a loss of estrogen can be a factor in weight gain, especially amongst women who are premenopausal or just starting menopause. But for prolactinemia, you do have that reduction in estrogen, which in turn is partly responsible for weight gain. So if you've been experiencing some weight gain just kind of out of nowhere with these other symptoms, you've been trying to lose weight by eating right and exercising, but you're still gaining weight, then that's an issue. And one of the biggest issues I have with this condition is that many people, if you talk to your doctor, you will tell them or ask them if weight gain is related to prolactinemia, and a lot of them will say no. And I really, really don't believe that, which is why discussing this and putting this out there is so important for me, because I cannot agree with the doctor when the majority of everyone, of women, I'm not sure about men yet, but the majority of women who have this condition have weight gain as a symptom before they start treatment, yet doctors are saying no, that it doesn't, there's no connection there, and I don't believe that to be true. So if you have experienced this and you have questions or you have comments that you want to share about your experiences or other symptoms that you've experienced, I would love for you to comment. I would love for you to post questions so we can start a dialogue, do some research together, and really get through this together. The biggest thing is, even with all these symptoms, if you get treatment from your doctor, these are manageable. I know it is more difficult the larger your tumor is, but really the only way to find out is to talk to your doctor, have the test done, have an MRI so they can really see. And then there are different drug options that you can choose to help with that. I would do your research on that. I take what's called cabergoline, which is the generic brand of Dostanex, I believe, I think. Some people really do well with the cabergoline because it doesn't cause as much nausea. That's one of the symptoms. But really, you have to listen to your own body, see what works for you. So I just wanted to kind of throw that brief thing out there. I will do another video researching more about the weight gain and other things like that. But anyway, just wanted to share that. Again, please comment, please question, and I will talk to you all next time. Bye.